Good morning, everyone, and welcome to the McLean County Chamber of Commerce Town Hall. This is our monthly McLean County Health Department update. Today, we're sitting down with Jessica McKnight from the McLean County Health Department and just getting our monthly update as it relates to COVID-19 vaccination program and the Restore Illinois plan. Before we dive into today's topic, we do want to recognize our June Video Resource Library sponsor. For June, that is Health Alliance. By sponsoring our educational programs, the Chamber is able to provide our member eds and town halls such as this to our membership for free of charge. So we are very appreciative of our Video Resource Library sponsors. And for June, that is Health Alliance. All of our member eds, and town hall presentations can be found on our social media platforms, but also in our Video Resource Library. The Video Resource Library is found on our website at mcleancodechamber.org, and the Video Resource Library is found under Member Resources tab on the website. Make sure to check it out if you haven't visited lately. Again, we would like to thank all of our Video Resource Library sponsors for their continued support of our programming and our outreach efforts. So I am going to stop sharing my screen and I am going to turn the floor over to Jessica for a quick update. We might be having some technical difficulties today, so if you see us pop in and out, that is why. But just a quick note, if you do have questions, you can drop those in the comment box on Facebook for those of you who are watching live. And so if you do have questions throughout, please let us know and we can answer those live. So Jessica, the floor is yours. Thank you again for joining us this month. We're interested to learn more about where our community is as it relates to the COVID-19 vaccinations and the Restore Illinois plan. So Jessica, the floor is yours.
All right, well, thank you for having me back again this month. I'm happy to say that we have, good news to share again this month, like we did last month. As a state, we are seeing daily reported COVID-19 cases, our hospitalizations still decreasing, and ICU capacity above that 20% threshold. Illinois also, as a state, has surpassed the goal of 70% of our adults having received at least one dose of COVID-19 vaccine by July 4th. So that is a U.S. goal that President Biden has set across the U.S. for 70% of adults to have received at least one dose. And at least as a state, we are meeting that. As of yesterday, McLean County residents, we were reporting 45.24%, so just over 45% of our total population fully vaccinated. And that's about 53% of eligible individuals, so ages 12 and up. So a little over half of our eligible population are fully vaccinated. We are still also, as a county, in the top 10 for percentage of fully vaccinated, which is great news. And, as a county, things have started to decrease as we have more people vaccinated. Demand is starting to decrease a little bit, but we're still, as a county, averaging around 500 doses of COVID-19 vaccine administered daily through all of the providers. In terms of our numbers, so we have started at the health department doing weekly data updates instead of our daily data updates. But we're still doing case investigation and contact tracing on all newly reported cases. So that's still going on. So today, Wednesday, is the weekly update. So new cases reported since last Wednesday is 16. So our previous week was 24. That's down significantly, to 16 new cases reported since last Wednesday. Our positivity rate for the county, the 7-day rolling positivity, is 0.5%. So again, just great news. We are sadly today reporting out one new COVID-19 related death, bringing our total in the county to 234. And there have been a total of 18,453 cases of COVID-19 reported in McLean County. So, just that this is a global pandemic, and, we're still seeing areas of the US and across the globe that are seeing upticks in cases right now, even though, we are seeing this downward trend. Those upward spikes, upward surges are being seen mainly where vaccination rates are lower. You know, we have more infectious variants that are circulating, and they're very prevalent right now. So while it is important and for us to celebrate milestones and positive indicators, we cannot let our guard down completely, still, you know, being aware of what is going on.
Great. Well, those are all positive things to report out for our county. That is great news. Again, I want to remind folks, if you do have any questions, you can drop those in the comment section on the chat we're on Zoom, on Facebook. So Jessica, I do have a few questions for you. So as Illinois and McLean County move into phase 5, so we moved into phase 5 on June 11th, a lot of questions are still being asked and still remain as it relates to masking for employers. So can you reiterate kind of who still needs to wear a mask and who should still wear a mask as it relates to CDC recommendations?
Sure. So I'm going to refer to the Restore Illinois, the phase 5 guidance for businesses and venues. The Illinois Department of Public Health has made this available on their website, dph.illinois.gov. So for indoor businesses and venues where everyone present is not fully vaccinated, unvaccinated individuals should wear a face covering and maintain social distancing. You know, it really, the guidance is focused on fully vaccinated and those who are unvaccinated. So, you know, at outdoor businesses and venues, unvaccinated persons can choose not to wear a face covering if they're able to maintain a 6-foot social distance when they're outdoors. You know, also looking at people who are immunocompromised. So even if you are fully vaccinated, if you are immunocompromised, you should consider wearing a face covering. If you're in a setting where other people are not fully vaccinated, talk to your healthcare provider also about, you know, any concerns you might have about going unmasked if you're immunocompromised. All unvaccinated people should wear face coverings in crowded settings. So, you know, early on in the pandemic, we looked at time, space, people, place. This still holds true with, you know, whether or not to wear your face covering if you're unvaccinated or vaccinated, thinking about, you know, how long are you going to be in a setting, how closely you're going to be to other people. And, you know, is the place well ventilated? Is it open air, you know, outside? So the same things are things that we want to keep in mind now that we were keeping in mind earlier. There are settings where even if you are fully vaccinated, you should still be wearing your face covering. So places like public transportation, congregate facilities, in a healthcare setting, or also where it's required by either federal law, state law, or local regulations, or even local business or workplace guidance. So though this guidance is out for people who are fully vaccinated, in some situations can go unmasked, a business or municipality can still have regulations in place that require everyone to wear a face covering.
Thank you. And I did, in the comment section on Facebook, I did throw in the link to Department of Public Health and the phase 5 guidance for businesses and venues that Jessica referenced. So that is in the comment box for folks to be able to get to. We did have a question come in and it asked, is there any updated information from CDC stating quarantine or testing guidelines for those who are fully vaccinated but then have COVID-like symptoms?
So, you know, even if you are fully vaccinated, if you have COVID-like symptoms, it's still recommended that you go and get tested. So, you know, if you go and get tested and you are awaiting results and you have symptoms, you know, we would recommend, obviously, for working, you know, you're not going to work if you are ill. So again, testing is still recommended, even if you are fully vaccinated, if you have COVID-like symptoms, especially if you have been around someone who is positive for COVID-19.
Thank you. So I'm going to go back to masking for just a second. From the public health guidelines and things, do you have any recommendations related to masking policies for our McLean County businesses? So are there things that folks should consider as they're looking at updating their policies?
So really just considering, in the interest of keeping their employees, their patrons safe, in the interest of sustainability of all of our businesses, an entity can continue mitigations, requiring mitigations such as face coverings. That face covering, social distancing are still best practices for reducing the risk of outbreaks, preventing spread of the virus. So there are some situations, like I talked about earlier, that do pose greater risks, such as indoor spaces and, places where more unvaccinated people might be.
Thank you. But definitely they should look at those policies and work with kind of within their own guidelines and their safety measures.
Yes.
So moving on, given our current low positivity rate that you recently just gave us, 0.5%, is that that's great. Yes. So given that, is there any chance Illinois or McLean County will regress back and move into a bridge or a phase 4 like we've seen in the past? Is that kind of on the horizon? I know you guys are continuing to monitor, but if we do, what would that look like? Do you have your crystal ball in front of you right now, Jessica?
Yeah, I don't know in terms of what mitigations might look like. The mitigations that we had in place prior, so last summer, were before we had a vaccine available to us. So, obviously things have changed there with masking based on what the CDC knows now about the effectiveness of the vaccines. But this is really another very pivotal point in the pandemic, because we're keeping a close eye on new variants. So the Delta variant, which was originally identified in India earlier this year, it's definitely a concern because it's already present in McLean County. It's known to be more infectious. And, again, like I said, while we have seen a decrease in newly reported COVID-19 cases in McLean County, we're seeing positive things. We have higher rates of vaccination here in our state than some of other locations in the US, in the world, that are seeing this new variant more rapidly spreading. And again, it's a concern, especially for unvaccinated individuals. So those are things that I'm concerned about. Is right now we have the vaccine very widely available to us, and the Delta variant, they're anticipating it being the most prevalent by late July, late summer. So right now, if we really concentrate on getting as many people vaccinated as possible, we're offering ourselves that added protection and potentially avoiding another surge in this fall. So that's something of concern, but I don't know what additional mitigations would look like if we did have that. If we did have another surge this fall, would things look differently? There's still a lot that we're learning about, the effectiveness of the vaccines that we have available to us, and the masks in preventing transmission and helping us control infections.
Thank you. I think that's, all the unknowns. There's still also many, we're learning more, but still a lot of unknowns out there as we move forward. For folks who are still interested in getting a vaccination, can you direct them where to go for that information? Where are vaccines readily available?
So they are readily available, at several pharmacies. On our website, McLean County, health.mcleancountyil.gov, we have a page that is for COVID-19 vaccinations. And there is listed all of the clinics that we are holding, but also a link to where you can search statewide. So search by zip code, places that do offer the vaccine, but local several pharmacies in the area. You can check with your healthcare provider to see if they also offer the vaccine, but it's pretty readily available right now.
Great. And folks, I know there's some places doing walk-up ones, don't even need an appointment. can just walk in and get those. I did, again, drop that website into the comment section on Facebook, so folks can readily get that as well. So as we move forward with vaccines specifically, there has been some chatter around the vaccines only being effective for a short period of time, such as 6 months, though likely longer. How will we know if we become vulnerable after a certain mark? Is there things we can do to predict kind of when we would need to be revaccinated or just kind of monitor? Do you have any guidance on those pieces as it relates to kind of how long that vaccination lasts?
No, yeah, we're really still learning how long the protection from the coronavirus vaccines will last. Questions of will it wear off gradually or suddenly? Will we need a booster shot? I know those are in everyone's minds right now. So unfortunately, we can't answer that with certainty just yet. Researchers know the vaccine has been effective against COVID-19 thus far, but there's really no track record to help provide us data for the future, which is the only way we can know for sure. So the clinical trials for the Pfizer and Moderna vaccines, they began around July of last year. So scientists are continuing to monitor antibodies in those who got the vaccines in the trials. So far, protection has shown to remain high for 6 months after that second shot. But, a slow decline in antibodies raises our hopes that vaccines could be protective for a year or longer. But again, we just don't know yet. I talked a little bit about variants earlier. If a new virus variant continues to circulate, or if it becomes, the dominant strain, a component of those vaccines might need to be changed to more closely reflect that variant. That's where we could, potentially see those booster shots. Just also want to mention the fact that the effectiveness of the vaccines that we have in the trials, those are for individuals who are fully vaccinated. So Moderna and Pfizer, that's 2 weeks after a second dose. Johnson & Johnson, the single dose, that's 2 weeks after that single dose. So just a little bit of stats for you while, when we talk about the variants and the Moderna and Pfizer showing to be effective against those, the Delta variant specifically, when you are fully vaccinated, it's about 88% effective against that variant is what it's proving to be. Whereas, a single dose, 33% effective. So, we encourage everyone to be fully vaccinated. And, if you're looking for that second dose, if you still need it, our COVID-19 call center is here to help you get scheduled for a second dose, get fully vaccinated. Monday through Friday, they're available, 309-888-5600. We want to see everyone get fully vaccinated.
Jessica, can you give me that number one more time? 309?
888-5600.
5,600. And you kind of cut out there a little bit when you're talking about the first dose, kind of your percentage of immunity versus the second dose. The first dose is like 35%, and then second dose, and I didn't quite catch that. Sure. Can you repeat those again? I'm so sorry.
We knew we might have some technology issues. So with the Delta variant, what we're seeing is just one dose, about 33% effective, versus if you had the second dose, if you're fully vaccinated, still against that Delta variant, showing to be about 88% effective. So it just shows you that added protection of being fully vaccinated.
Great. Thank you. Thank you for repeating that. So again, if folks do have questions, please feel free to drop those in the comment section. I will get those to Jessica. I do have one more final question kind of on my queue, but if you guys have others, I will add those too. So my final question for you today, Jessica, is do you have any tips for employers when speaking to their employees as it relates to vaccinations? Are there resources employers can utilize when kind of educating employees on exactly what you talked about with the vaccinations and kind of the benefits of that? Do you have any tips for folks as they're looking at their policies as it relates to vaccinations?
It can be difficult conversations. Different people have different thoughts, opinions, concerns about the vaccine, and all those should be validated. But if an employer is able to answer questions or point someone in the direction of where they can get factual information to answer their questions, that can be very helpful. So the CDC on their website, they have a lot of useful information about COVID-19 vaccines, the development, the safety of the vaccines, how the vaccines work, their effectiveness, possible side effects, and benefits to individuals that become fully vaccinated. We also have 2 links on our health department website to virtual town halls that were held earlier this year. Local providers answering those frequently asked questions, again, about the same topics, the safety, the development of the vaccine, the effectiveness, and really just trying to answer those questions, ease any concerns that individuals have. But again, just being understanding that different people are going to have different thoughts and opinions about, and even concerns about, the vaccines.
Thank you. I did put the CDC link to the key things to know about the COVID-19 vaccine link in the chat for folks. So again, folks have that readily available. Before we log off today, Jessica, any final thoughts, comments you want to make sure that our chamber members are aware of as it relates to all things vaccine, Restore Illinois plans, public health in general?
Just reiterating that, right now is a very pivotal point. It's very important. We have the opportunity now with the vaccine being so readily available to get as many of our residents fully vaccinated as possible, to help us, as we are seeing these new variants emerging, just having as many people protected as possible, for yourself, but also your protection will help those around you as well. And, it's never been easier to get a COVID-19 vaccine with, like you said, many clinics and McLean County Health Department clinics being walk-ins. You don't need an appointment. Go to our website. You can see when we're going to be holding clinics, what vaccines are offered at most of our clinics at the arena across the street from the health department. We're offering all 3 of the different types of vaccines. So again, it's never been easier. If you want to get scheduled or you need more information, our call center is available to you Monday through Friday, 9 a.m. to 4 p.m. And we're happy to talk to you and answer any questions that you have.
Thank you so much. We really appreciate you taking the time today. I'm not seeing any additional comments or questions coming in on Facebook. So we do appreciate you giving us an update from the health department. Jessica and I spoke briefly beforehand. We think we're going to pause for July and come back in August for our monthly update, unless something changes. So we'll do that caveat. But again, for more information, make sure to check out the McLean County Health Department. It's health.mcleancountyil.gov, and that is in the comment section on Facebook. The Chamber would once again like to recognize our June Video Resource Library sponsor, which is Health Alliance. Again, because of their generous contributions, we are able to provide these informational sessions, and we have appreciated doing that over this year. Make sure to check out our Video Resource Library, where this posting will be put, as well as many others. So this concludes our McLean County Health Department Town Hall. Thank you, everyone, for joining us today. Have a wonderful afternoon.